So a little bit about myself, I should say, before we get started. I'm one of the faculty members in the online MPH program. My name is Dr. Caitlin O'Keefe. I'm actually stepping in for our academic lead in this program, who unfortunately was unable to be here today. Dr. Sloan Burke-Winkleman, fantastic. Many of you have already reached out to her or might have already reached out to her via email. She's wonderful. She'll be the person to go to really answer a lot of the academic questions, but you're absolutely welcome to reach out to me as well, or a lot of our kind of members of Sang College who will do a lot more of the program-specific questions. So again, we'll have a lot of people here to answer your questions now and afterwards. All right? All right, so let's jump in. Not a very long presentation, if I can get the presentation to work. All right, so again, welcome. So we really want to focus a lot more today, letting you know, a little bit more about the program specifics, but really answering some of those questions that you might have. Why do I want to choose CSUN? Why do I want to choose a master's in public health in general? What can I do with it? What will this online MPH give me? So we'll go into a lot of those specifics today. So one big thing, we'll first kind of talk a little bit more about the online program itself, and then we'll jump into a lot of other topics and then really end with our online program again, more of those specific components that you might be curious about. But, why would you choose CSUN to get your MPH degree? So one of the best things about this degree and the online MPH here at CSUN is it's very much an applied practitioner-based degree. Some of you might already be working in the field of public health. Some of you might be interested in directly working in the field of public health. This is the degree that's going to help you do that. So we're going to really connect you to people in the workforce. Really, our whole educational design is to get you with the skills that you need to jump right into the workforce if you're not already there, and really kind of grow in the workforce if you are already in the public health workforce. So it's really an applied degree that you can directly use the skills as you're going through and directly use after you graduate. So again, why CSUN? We are a long-standing program. Programs at CSUN in public health have been around for 50 years. So we have been here, the program has been established for that long. We have a good idea what people in the field might need. So what public health practitioners need, what skill sets that they can use in public health practice. CSUN has a really kind of university-wide, a really amazing faculty base. In the online MPH program, you're going to be working with a wide variety of faculty. So a lot of us have been working in this field for years, if not decades. Lots of different specialties as well. If you're interested in nutritional health, faculty members have worked in that for years and years. We have faculty members who work in women's health, international health, kind of more the epidemiology, biostatistics side of things, infectious disease, chronic disease, people that work in really anything that you can think of in public health. We have faculty members who you will be working with during your online program in things. So really, really great opportunity to work with good faculty who can also connect you to really great kind of members, preceptors in the kind of surrounding area or outside of the surrounding area that might be able to answer questions, or you might be able to find an internship with or a job later on. So lots of strong, different, diverse backgrounds in our faculty base. You're going to have direct access to kind of working, learning from everyone in our department. So we have really excellent partnerships. I kind of alluded to this. We have really great partnerships for internship opportunities. Again, some of you might already be in the field of public health and just looking to advance, kind of get more education to advance in your own careers. Some of you might not yet be in the field of public health and might be really interested in kind of seeing what's out there, maybe changing careers, doing a different career. Our program has a lot of internship because we've been around for 50 years. We have a lot of connections with community-based organizations, federal organizations, state health departments, city health departments, county health departments, a wide variety of things. And we'll go a little bit more into that, but lots of connections that you can make working with the faculty here to other members of the community who might be working in the field. We have a cohorted program. So the online MPH is a cohorted program. So what does that mean? Basically, when you come into the program, you are going to be with the same people throughout, the same kind of other members of your cohort throughout the entirety of your program. Why would this be a good thing? So lots and lots of reasons, and we'll just touch on a few. A really important thing that, here at CSUN we've kind of found is online MPH programs, give a lot of good information, but we also want to maintain that sense of community. So it can be kind of hard to know how to do that in an online environment. We want you to be connecting with your peers in the program. So you're going to be following through the program with all of the peers that you started with. You're going to be making connections with each other as you're going through the program. So another really good thing about the cohorted program, it is designed and really focused on busy mid-career adults or people who might be working long hours. That cohorted program is going to allow you to ensure that you always get the classes that you need. So there's not going to be any worry about, oh, this class filled up, or I had an issue getting in. We have that scheduled for you. We know exactly when you're going to be taking those classes. We have that all planned out. So you are guaranteed those classes as you go through. So it's really a great program. If you are working a full-time job, it allows you that flexibility. And we'll talk a little bit more about that flexibility later on. But the online degree really gives you that ability to, live your life, do all the other things that you have to do in your life, but also be getting a degree at the same time, and a really powerful and important degree. CSUN also has collaboration, kind of our online MPH program, really represents a collaboration between two different colleges. So the academic side is really through the College of Health and Human Development at CSUN, really well-renowned program. A lot of our faculty members work specifically in the health science department, but we do have other faculty members in other departments within that College of Health and Human Services. So you have people who are specializing in their fields, teaching you the classes. So really going through, working with you, week to week, kind of getting you that knowledge that you need. Benefit those, you also have Sang College, and Sang College has been around for a while. They know exactly how to best run an online program and really fit that to your schedule, fit that to what you need to get out of the program. So kind of the biggest benefit, just in numbers, you have two colleges that are working for you. You have two whole sources of information to get information from, two kind of support systems as you're going through. So we're all happy to answer your questions kind of before, during, after the program. You're going to make a lot of connections with a lot of people here that really want to see you excel with your degree in the program and after. So let's talk a little bit more, now that we've kind of gone into the basics of why you might be interested in an online program or online MPH here at CSUN. Let's talk a little bit more about public health and really focus on why you might be interested in MPH. And a lot of you might have very different reasons, but we'll kind of go over some basics and then really focus a little bit more on what you can do with your MPH degree. So kind of the new reality that we're seeing, in the US, but also globally, but let's focus specifically on the US, the Affordable Care Act, or Obamacare, that we've been talking about for quite a while, several years, right? It's provided a lot of new opportunities in the healthcare industry, which public health is a part of, right? So they really focus, and the focus has transitioned away from straight treatment of individuals, a lot more focused on prevention. And you will be right at kind of the cutting edge of prevention with an online, or with your MPH degree in general, with your master's in public health. So we'll talk again about the degree a little bit, but really focusing on prevention and kind of how to improve health of communities and populations is going to be the focus of an MPH program. So, if that sounds like something that you might be interested in, this is the program for you. So today's leadership, so why would you go to a graduate degree program? Well, we know that today's leadership positions really require that graduate degree. You can get into careers in public health with an undergrad degree, sometimes with a high school diploma, but really to excel, to get into those leadership positions, does take experience, but it also takes that background in health education, in public health. That's what we're going to focus on a lot in this program, preparing you to enter in at leadership level positions, or preparing you down the road for leadership level positions, really giving you a lot of different information and skill set that you can use to excel. When we're looking at kind of just reality in today's society, we know that we have a growth in aging and immigrant populations. And in health, we need to find a way to address that. One thing that our program is going to do is really kind of focus on how you address that in the community. A really good thing about the program as well is there's kind of an increase in aging, a growth in immigrant populations also means a growth in jobs, health education jobs, healthcare jobs in general. So there's a lot of opportunity, and we'll go through the opportunities and the job growth in this particular field on the next couple slides. So when we're talking about also public health, looking at it kind of widely, there's been a huge globalization of just the healthcare industry, right? So we see a lot of people who get their degrees in the US going to work internationally, and that is absolutely something you can do with your degree. And we'll connect you with people, if you're interested in international health, we'll connect you with people in international organizations like the WHO that can kind of help find a place for you in the global world of health. So if you're interested in working domestically, fantastic. Public health also obviously works in the US as well. So if you're more focused on that, we can try to connect you to people who more work in that. But really you're gonna get the education and skill set to do what you want with your degree. So let's talk a little bit about growth. We mentioned that word growth before. Healthcare industry is growing. What does that mean in numbers for jobs? Are you going to have a job possibility after you get this degree? Are you getting this degree for a reason? And absolutely the answer is yes. So public health occupations across the board are growing faster than the average growth for all US occupations. They're growing about double the growth for the average kind of all US jobs together. So when we're looking specifically at public health employment and public health educators and kind of the field of public health, from 2012 to 2022, good while from now, there's expected to be 21% projected growth. Again, this is double other occupations. So we know that there are jobs now. We know that there are going to be jobs in the future for you after you graduate with your degree. So I know that's always a concern. You're going to leave with all this education. Are you going to be able to apply it? The answer is definitely yes. Across the board, looking at public health kind of, in respect to the overall healthcare industry. So the healthcare industry is expected to generate about 5.6 million jobs by 2020. So again, there's gonna be lots of opportunities of employment in the healthcare industry, and we'll go into a little bit of what you can do with that public health degree, but really public health educators, people who have an MPH work in so many different fields in public health. So there's so many different opportunities in the healthcare industry to find a place for that, depending on what you're interested in. So lots and lots of opportunities. The demand for healthcare and health-related professions is really soaring in the US. So again, double the rate of other occupations. So this is definitely something where, you can use. All right, so let's talk a little bit specifically about a master's in public health. What can I do with an MPH? Some of you might have well researched what you can do in public health. Some of you might know exactly what you want to do in the field. Some of you might have just kind of found public health as an interest and want to know a little bit more about it. The MPH will give you a really solid degree and foundation in public health, and we'll go into different jobs. A lot of people in public health we see really not have started out thinking about public health, right? They didn't grow up thinking they wanted to work in public health as public health educators, but maybe they grew up knowing they wanted to help people, right? And there's a lot of different ways, a lot of different professions that you can help people in. So in a lot of people we have coming into the program, we're just interested in public health, kind of had this idea, wanting to help people, right? So maybe a little bit focused on more medical, wanting to treat people, help people. We see a lot of people transition from really kind of that more clinical mindset, so wanting to be a physician or a nurse, transitioning to the field of public health as an interest after seeing kind of all people who might have a disease. You might have a close family member who has had an illness, and you might wonder to yourself, well, as much as it's very important to treat these illnesses, maybe we take a couple steps back and prevent them from ever happening, right? And that's really what we can do with public health. Public health works on kind of this population level, really looking to prevent disease rather than just treat individual cases. We're looking to develop programs that focus on health prevention, really developing, kind of having people develop healthy lifestyles, healthier ways of, diet, exercise, anything related to their health that can help kind of benefit their health down the line. Maybe save having to have treatment later on. And again, we see that being a focus now with the Affordable Care Act, with a lot of insurance companies, health insurance companies, are actually focusing more on going towards prevention, right? It's one of the reasons why we expect so much growth in this field, so much need for health educators, because people are realizing, hey, if we prevent things early on, we won't have to spend all this money treating diseases, right? So really that keyword is prevention. So what can you do with your MPH degree? We said to be in those leadership positions, to kind of direct and design programs, you might need a little bit more than, an entry-level position or an entry-level degree, right? So your MPH is going to allow you those additional skill sets to actually start, again, being in a director position, being in a leadership position in a health department, in a health organization, in a hospital. So lots and lots of things you can do. So let's talk about a couple of these specifically. So what can you do with your MPH? You can create, direct, and advocate for approaches focused on prevention and extending lives. And the great thing about an MPH is you will learn how to design a program. So, without an MPH degree, you might be more in a supportive role or coordinating role. Fantastic need for those roles, but if you're interested in creating things, designing things, having kind of a hand in directly forming a program, an MPH will allow you to do that. And the MPH here, our online MPH in community health education, will really give you the skill set to be able to design programs, design curriculum for different kind of programs that you might want to enact. We also can, with MPHs, conduct needs assessment. So needs assessment, doesn't sound like the most exciting thing. You're going out, you're finding out what's happening, where you can help. It's actually incredibly exciting to be out there, finding out where are the gaps in health, what programs are needed in a community that really can help have a huge impact on expanding, kind of improving health in a community, right? So really conducting that needs assessment, finding out the gaps, finding out any health disparities between different populations, and really focusing on what programs that can be best used in that community, most effective. You can, with the skill set that you're developing with your MPH, you can help or conduct those, direct the conducting of those yourself. So we can also implement and evaluate health-based programs. If you have an interest in program development, so if you want to design a program kind of from scratch, know, not only the needs assessment side, but know what programs might work and might be effective, but also help in the designing of that program and direct the designing. Again, this is the degree for you. This will allow you to kind of learn how best to design a program. What are the behavioral features that you have to take into account when you're trying to see if this program is going to be effective, right? What are the population characteristics that you need to take into account? How do you evaluate a program that you've created, right? Once you've created a program, you've implemented the program, do you just step back and kind of leave it as is? No, you want to know if it's working, right? You want to know what can be done to make it more effective, or is it as effective as it can be? Does it need to be significantly changed? That's what this degree and this skill set is going to allow you to do. So when we're looking at kind of our community health education MPH or online MPH, you're also going to develop the skill set to create relevant communication materials. Again, this sounds kind of dry, right? Communication materials. Think of all the changes in the communication industry that's happened in the last decade, right? So the Centers for Disease Control, the World Health Organization, the California Department of Public Health, all of them have Twitter accounts now, and that's how they're disseminating information to the public. It's not just brochures, that's absolutely part of it, brochures in maybe a physician's office or a health department you might go into, communicating important information, but also really kind of using Twitter, using Facebook, really getting the word out there to different communities in the most effective way, and really designing how to kind of create effective materials. And that's what we'll definitely talk about in several of the classes in the online MPH program. So you also lead and execute programs, personnel, and budgets. So if you love to direct people, if you love working with people, you love to direct people, and you love to design programs and work with the people implementing these programs, this is the degree for you as well. So you'll really get that opportunity to play a part in a director or leadership role with a graduate degree in public health. So it'll allow you to execute these programs that you might have had, free reign in designing and kind of find out the needs assessment to design it, design the program, and then you'll actually get to implement and direct the implementation of some of these programs. You'll be able to do that with your degree. So really, really different things, all kind of related, all things that you're going to be able to do and you're going to learn about doing in the MPH program. And if you already know, you're going to learn more about doing in our MPH program. You're also going to be able to apply epidemiologic principles and analyses. So when we think about epidemiology, again, kind of long, complex word, really talking about the distribution and determinants of health, right? So distribution of disease, where is disease, what are risk factors for disease, and then taking that information, that epidemiologic information, and applying it to developing programs. Okay, we see this many people with disease in this community, a lot less have disease in this community, so maybe we focus our attention, we focus our program development in the community that seems to have more of a need, right? So really being able to apply that research, apply those numbers to develop the most effective programs, to kind of work with populations in the most effective way, to really focus on that prevention of health, or prevention of, disease down the line. So we also apply contemporary concepts and theories as innovative, globally marketable public health professional. That's basically a long way of saying we're going to apply these concepts and we're going to really focus on, in this program, having you learn about concepts, learn about theories, but also direct application. And that's more of that kind of application principle of this program. We are trying to train you to be public health professionals, kind of at that, more director level of things, right? So in that more leadership role. So really applying the principles that you learn, applying those concepts of behavioral theory, and really focusing on how to use that to better the health in a community. So lots of different things that you can do in the US, lots of different things you can do on a global scale, right? So an MPH degree is globally recognized as being a really important degree when we're looking at population-based health. So in this particular program, what courses are you going to take? We talked a lot about what you can do with it. What courses are you going to take though, right? So you're going to take, this is a MPH, an online MPH program focused more on community health education. Don't have that thing, all you're going to be doing is educating. You're going to be doing so many different things in public health, right? All kind of designed around that prevention strategy, preventing kind of negative aspects of health in a community. So you're going to take courses in environmental health. So because it's a really important part of kind of that whole wide public health field. You're going to take courses in health behavior theory, biostatistics, program planning, epidemiology, curriculum design. Again, we're going to give you, the MPH program, Masters in Public Health, is really designed to make you competent in all fields of public health. So those 5 pillars of public health are environmental health, kind of health behavior theory, social and behavioral theory, biostatistics, epidemiology, and health administration are kind of our 5 pillars. You're going to take classes in all of those things. If you want to be, and you want to do any of these things, you will have the skill set to apply that. So, and again, the kind of detailed brochure goes into the different classes and the different names, but I'm happy to answer questions about what the classes are like, what information they might contain after the session today. One great, fantastic thing about our program is we are celebrating nearly 50 years of public health accreditation. So what does accreditation mean? What does that mean for you? The Council on Education for Public Health, CEF, is really our accrediting body for schools of public health and programs in public health, kind of nationally scale. So we have been CEF accredited for between 40 and 50 years. So this has been an accredited program. The online MPH program is an accredited program, kind of with the stateside or kind of in-person MPH program. So you have, and what CEF does, that whole accreditation process, they really make sure in this program you will get the fundamentals of public health, right? Because they want public health professionals leaving a program to be trained appropriately, to be that kind of well-rounded, broad-reaching professional. So CEF kind of accredits, and there are yearly processes that you have to go through and that we've had to go through to maintain that accreditation, but we've been accredited for decades. So really a strong program that you're going to be entering in and hopefully going to be a part of. So let's talk specifically about job titles in public health. We're going to focus more on kind of the general field of public health, kind of giving you a scope of what you can do with your MPH degree. And keeping in mind, this is an MPH in community health education, but again, you're going to be working with so many different professionals in the field on a daily basis. Your peers outside will be of different members or fields and specialties in public health, but all of you are going really towards that same goal. Right? That same goal of prevention, of kind of increasing health in a community. So, and again, we're going to talk specific job titles, but also kind of worrying about what jobs are around afterwards. You might also be worrying what salary looks like, right? So I'm going to be spending money on an MPH degree and then, not making any money at all. So we wanted to give you a sense of kind of average salaries. One thing I will say as you're looking at these, let's talk about first health services administration. So, maybe you go to be a hospital administrator, maybe you go to be kind of a health administration management personnel, right? So this number is really going to focus on people with non-graduate degrees, so more entry-level positions, right? So when you're thinking about, well, where do I fit in there? You're going to be kind of in the middle and possibly with the potential to grow to that upper range, right? Keep in mind the upper range will be, years of experience, but these are averages of that profession, right? So we have biostatisticians, biostatistics. You'll take classes in health administration. You'll take classes in biostatistics. Again, making you that well-rounded public health professional that you want to be leaving a graduate program. So you'll take classes in biostatistics. You'll take classes in epidemiology, really studying the disease distribution, studying risk factors for disease, being a little bit more of a disease detective. You'll focus a lot of your classes on health education and behavioral science. How can you design programs? How can you implement programs improving health in a community, improving health on a global scale even? So when we're looking at environmental health, again, you're going to take classes on environmental health because environmental health is an important component of public health, right? So kind of slightly different field, do different things. Maybe you do environmental and occupational health, lots of different things you can do with it. As an MPH in this program, you will be working with environmental health specialists on things, or can be working. So you'll get kind of that skill set as well. You can work in international health. We said not only is this kind of a U.S., not only can you apply your skills in the U.S., an MPH degree is recognized worldwide on a global scale. That accreditation that we said that CEF accredits us, really, again, that's designed to have you leave a program as a competent public health professional ready to jump into a lot and tackle a lot of different things when we're talking about public health. So you can work in nutrition, education. There are a lot of ways of blending a lot of these different things. And again, you'll be blending a lot of these different things, working with different people in the field. So, and then we have public health practice or program management. Again, you can jump into this with your MPH degree, really focusing on public health practice, right? So program management, you can work with people who are managing programs. You can direct and create programs yourself, right? So it just depends on exactly what you want to do, exactly what you're passionate about. The best thing about an MPH, it allows you to do what you're passionate about. Apply all the skill sets that you'll learn while you're getting your degree into something you're passionate about in your career. Really working with a population you're passionate about, working with a disease you're passionate about, or some other health outcome that you're passionate about, right? So you can work at a biomedical laboratory. And these are all national averages for salary. Again, these aren't necessarily, I wouldn't look either at, certainly not the low end of things because those do represent more entry-level positions, but just so you have an idea of exactly kind of what you're getting into, right? We said there absolutely are jobs out there. That job growth is expected in the next decade, right? It's particularly in this field. So looking at places you might work with your degree, there are so many different organizations that you're going to work with and that we're going to connect you with in this program. So you can work with, after you leave, you can work with the American Health Association, Centers for Disease Control. We have former students who have worked in a lot of these different organizations, followed their passion, right? So worked with the American Cancer Society, worked kind of on a more global scale with the World Health Organization. But again, you can work kind of nonprofit. Don't think you're going to be stuck in one job in one place, right? There are lots of different organizations that you can work with. Nonprofit, global organizations, county or city health departments, or state or federal health departments, right? Also, lots of other organizations, hospitals, physician's office. That whole idea of focusing on public health prevention is so wide when we're talking about the healthcare industry. So lots and lots of opportunities, lots and lots of different places. So fall 2015 cohorts are accepting applications now. I believe the deadline is May 1st, so I encourage you all, try to apply by May 1st. Get your questions answered tonight. Email in the next week, get your questions answered. and apply. So it's a great program to be. I would love to see you all in the program next year. So applications are accepted on a rolling basis. So even though we have that deadline of May 1st, we will still accept applications after that on that rolling basis. But again, best advice, apply as early as you can, right? Get your questions answered as early as you can. So you can apply online, requires a bachelor's degree in any discipline. One of the nice things about public health and one of the fun things you'll realize in your cohort is you have people from so many different backgrounds. People that might have gotten a degree in sociology, people that might have gotten a degree in anthropology, in biology. Public health has that broad appeal because we're focused on kind of that health prevention, right? So lots of different specialties coming in. So you just need a bachelor's degree in any discipline. You need a GPA, your last 60 units of about 3.0. If you have a lower than 3.0 GPA, 2.5, you do need to take the GRE. If you have a 3.0 GPA or higher, you do not need to take the GRE to be accepted. So just keep that in mind. I know there's a lot of things to think about when you're applying to graduate school. The GRE, or the kind of graduate school standardized test, is one thing to think about. You only need that if you meet the specific requirements for GPA, if you fall under that 3.0 mark. All right? So the cost of the program, again, and I encourage you, think about cost when you're thinking about different programs, but also think about cost and what it can do for you in the future. What will this degree give you? Again, you know, MPH degrees, a lot of those leadership and director positions will require, that come with higher salaries, will require a graduate degree. So the cost that you're having now can, you know, benefit you significantly in the future. There is financial aid offered kind of in this program, and I'll have Jesse speak a little bit more to that, or, you know, we do have a lot of information for that. All right, so again, we're going to give you some handouts and provide you some handouts with information. Has everyone seen there is a website online? Has everyone gotten a chance to go to the website? All right, the website is also listed on the brochure, so, and that should answer a lot of general questions that you might have about program specifics, but I encourage you, reach out if you have questions to the academic lead, myself, any other faculty members, or the SANG kind of program manager.